Good afternoon. Rod doing a little sleeping on the job this afternoon. With reason, because we're going to be taking a look at what might be keeping you up at night. He is connected to equipment you can use at home to help you diagnose a sleep disorder. Dr. Cam Atwal with Adventist Sleep Disorder Center is with us to explain the process Rod is going through over there. What is he hooked up to, doctor?
So he's actually hooked up to something called a home sleep test. So a home sleep test evaluates people for sleep apnea. Now, sleep apnea is very prevalent in our society, and usually we all joke about that one person that snores so loudly. I mean, I had a patient come in the other day, and I said, "Why are you here?" He said, "Because my neighbor's complaining." Why was his neighbor complaining?
Not only the wife, but the neighbor.
I mean, he was snoring that loudly. So we laugh at snoring, but snoring can, potentially indicate a very serious problem. I mean, if you're snoring, you're tired, you have high blood pressure, you're male, you're above a certain weight, those are huge risk factors for sleep apnea. And what is sleep apnea? Sleep apnea is basically the back of the throat closing off when we sleep. Throat closes off, air doesn't get into our lungs, oxygen goes low. So you sleep the night away with really low oxygen.
Now, doctor, you always hear the commercials, you see them about the sleep clinics. You can go in and test to see if you have sleep apnea. But so this would replace that? You can do it at home?
Yeah, tell us what Rod's wearing.
So Rod is wearing basically a nasal cannula, which is following his nasal flow. So if there's no flow there, that means he's not breathing. He's wearing a belt across his chest that's measuring if he's moving his chest. Because if his chest is moving and there's no airflow, you have an obstruction in your throat. And then he's wearing a probe on his finger that's actually measuring his heart rate and his oxygen level. So it's a very efficient way of getting a basic sleep test done in the home environment.
Have to ask you, Rod, could you sleep with all that equipment on?
Well, not with the racket you people are making over there. No.
Oh, excuse us for being so
No,
rude.
Actually, the belt piece across my chest, not a problem. I mean, the nose thing's a little ticklish, actually. It would take some getting used to, I think, though, for me. But it depends on how tired you are, I guess.
So then how long do you wear it, and how long does it take to get an answer?
So basically, we program the machine. We ask the patients what time they're going to bed. So a typical patient says, "I'm going to bed at 10 and I usually get up at 6. We'll program the equipment for you. So you just have to put the belt on, the nasal cannula, the finger probe, and you can go to sleep. And then you can get up and go to the bathroom if you want. You can sleep on your side, you can sleep on your back. It doesn't matter. And we basically ask the patients at the end of the night to indicate to us when they went to sleep and when they woke up. And sometime in between that recording time, there's obviously sleep. Then we review the data the next day. And within about 48 hours, we usually have a summary of how many apneas per hour. Apneas meaning not breathing or not breathing enough, how many events per hour. And that indicates the degree of sleep apnea and how serious it is and how we treat it.
Is it as effective as going into your sleep center and spending the night there and being analyzed in that method?
Very good question, Kathy. So who needs an inpatient study? Most patients can get away with a home sleep test. But if you have emphysema, you have heart failure, you have a lot of other health issues, you might need an inpatient study. And the only difference between an inpatient study and a home test is that the inpatient study tests a lot more things. We actually put EEG leads on. So Rod thinks that's tough to sleep. Just think if he had all these leads on his head and he had
you
a lot
weren't in your
more
own
leads.
bed.
Yeah, exactly. And so that measures stages of sleep. It measures limb movements. I mean, you really look like you're a puppet, when you're tied up to that equipment.
Oh, Rod has a question.
So, well, doctors, I'm surprised when you said it doesn't matter the position that I sleep in. So that has nothing to do with my sleep apnea.
Actually, when I say that, because patients say to me, "Oh my God, I have this equipment, I have to just stay on my back, I can't sleep on my back." And I tell them, you can go on your side, but you bring up a good point, Rod. Your sleep apnea will actually be worse when you're on your back, because you think gravity is, hitting you at a 90-degree angle. So definitely position does matter. Sleep apnea will be the worst on your back. It will still be there on your side, but it might not be as prevalent.
Doctor, I'm curious, at what point do you need to get one of these machines? I mean, is a normal amount of snoring okay? Is that normal to snore or not at all?
You ask a very important question, Ashley. So does every person that snore need to have a sleep test? No. However, if you snore and you're tired in the daytime, you have a history of high blood pressure, you are overweight, you're of male gender, you're above the age of 50, those things, if you answered yes to any of those questions with the snoring, more reason to go and talk to your doctor.
Rod's raising his
Did I
hand.
give you enough reasons?
Well, maybe you could take that home with you tonight.
I feel like I'm being assaulted here. You just described me to a T, Doctor.
I think you need to come and pay me a visit, Rod.
Doctor, did we ask, are these covered by insurance typically?
Absolutely. So when we do order a test, we run it by the patient's insurance company and we get the approval to do the test.
All right.
And Rod will get approved, guaranteed.
All right, Dr. Cam Atwell with Adventist Sleep Disorders Center. Thanks so much for
Thank you
coming by this morning.